Well, hello everyone. This is Chris back again with the Ancient Scholar. Today, what I'm going to talk about is the Registered Respiratory Therapist written examination. There are actually two separate examinations one has to take to become a Registered Respiratory Therapist. The first, obviously, they have to be a CRT first, pass that exam, but to pass the core RRT examinations, there's something called the RRT written examination and the clinical simulation examination. What I'm going to talk about today is the written examination. This is the exam that I actually just completed and luckily passed. So I've got one more down and one more to go. So we'll just go ahead and do a quick review, kind of like I did with the Certified Respiratory Therapy board exam. Just kind of give you a rundown, kind of my impression, and maybe just some tips and hints. So first of all, the RRT is similar in content to the CRT. There are 115 questions that will be asked. Only 100 of those 115 are actually scored, and there are 15 what they call pilot questions that are not scored and do not count toward your grade. So I would again give this same advice that if you get these really kind of crazy questions, don't allow yourself to become distracted by those and to lose your bearing, to lose your focus, because it may in fact just be a pilot question. So 115 don't count. So out of the 100 questions, the RRT is divided into three general categories. There's patient data evaluation and recommendations, equipment manipulation, infection control, and quality control, and initiation and modification of therapeutic procedures. So the RRT written exam was a little different than the CRT in that the content of the questions was very different. The CRT examination had more what were called recall questions. Basically, on the CRT, you'd have several questions that would ask, well, what's the normal central venous pressure? And then you just have to check the normal 2 to 6 millimeters of mercury. A pretty straightforward question. The questions weren't quite as straightforward here on the RRT, and the questions were more based on what we call analysis, where you might get a scenario. Maybe somebody on a ventilator, they have ventilator settings, they have an arterial blood gas, and then they will tell you about what you see on the chest x-ray. And what you'll have to do is you'll have to put all this information together and come up with what is really going on with the patient. And then maybe they'll ask, is this somebody with pulmonary edema, with pneumonia, so on and so forth. So the questions are a little more involved intellectually in that it's not simply just a yes-no, memorizing a number. It's a little more, you have to be a little more cerebral, I guess, for lack of better words, and actually think about it and process different types of information, put it together, and then select the answer. I will say that it is not significantly different from the CRT. If you do well on the CRT, I would expect that you would do well on the RRT written. I was within a few percent, or I'm sorry, a few units of what I scored on the CRT. Now, the RRT written is a little different from the CRT in that it's actually similar in that you are still doing what are called scored scale units, or scaled score units rather. On the CRT, you needed 75 of these units to pass. On the RRT, you only need 70 to pass. Now, just like the CRT, this is not a percentage. This is not a percentage. And the percentage of questions that you actually have to get right to get 70 scaled or scaled score units is going to vary. It could be higher or lower depending on the types of questions that you got. So if you get really hard questions, for example, maybe the percentage to get that 70 those 70 units would be lower. But if you got maybe a bunch of easy questions, then perhaps the percentage of questions you need to get right would have to be higher. So in the case of my exam, I needed to get 64 correct answers out of 100. So 64% to would have gotten me a 70 units. So you can see there's the difference. 70 units is not a percentage. So just kind of keep that in mind. That is not based on a percentage necessarily. It's based on kind of how difficult the questions are. Okay, so talking about the three major content areas, I had 28 questions on patient data evaluation recommendations. And this is an area that I didn't do as well as the other two areas. Looks like I may have had a few issues. Some of the things that this will include would be looking at data, reviewing patient records, what kinds of things, what kinds of history and examinations and tests would you want to do based on some information from a patient. Maybe they'll give you a scenario, and then you have to figure out, okay, well, this scenario is pointing toward this certain condition, and what kind of test do I need to order, or what kind of assessment do I need to do. Collecting pertinent clinical information. Again, this is more of a data collection process, and I'm not that surprised that I didn't do as well in this section, simply because my nursing background leads me to think of very different things than a respiratory background. I think a little more holistically, if you will. So I think about a lot of ordering different tests and examinations that are probably a bit more extraneous to the respiratory therapist. So that's sort of a pitfall for me, but probably not necessarily somebody who doesn't have medical background. Equipment manipulation, infection control, quality control. I got about 12 questions out of there. Mainly infection control questions, like how to sterilize equipment, if you autoclave something in the strip didn't change color, or maybe they found spores. What kinds of things do you need to do? This goes into if you use a solution to soak something in, how often you have to change that solution. What kinds of solutions should you use? What should you use at home for home disinfection? Things like white vinegar, and how long do you dry, and the importance of contact time and things like that. And then the last section is initiation and modification of therapeutic procedures. I got 60 questions, so this is actually the majority of the examination fell into here. And again, this one was a little different from the CRT, and that was a lot of scenario-based questions, or what we call analysis questions, where you are given a scenario, you're given a lot of information, you have to analyze what's going on, and you have to choose the best answer. And just like the CRT, the answer may not be the one you want, or it may not be the textbook answer, but you still have to choose the most correct answer. I'll give an example, and again, I'm not going to give examples of specific questions, but let's say that you see a picture of a flow time scaler, and it indicates auto PEEP. And and then of course you have an ABG, and you have some vent settings and all this, and you realize, okay, this patient is developing auto PEEP. That is an underlying problem, or it may be one of the underlying, maybe there are other problems, but then it'll ask you, okay, what do you need to do about this? And then you'll have 4 different things that you can do, and you have to recognize that what they're wanting you to address is the auto PEEP. And we're used to doing things like increasing the flow, because that will decrease the I time and increase the E time and help take care of the auto PEEP. But let's say you don't have that. Let's say that's not one of the answers. What other things can I do? And that's what kind of makes this hard. Is sometimes there isn't a textbook answer. Sometimes it may be something like decreasing the respiratory rate or the mandatory rate to manage that auto PEEP. In conclusion, this was still a fairly technical exam, a lot of equipment questions. Again, you're going to be asked a lot of ventilator questions, a lot of equipment questions. There was not as much math. I did not counter as much mathematics on this exam as I did the CRT. I didn't have to do as much calculations on this exam. But I did still have a lot of equipment questions, mainly ventilator questions. And so it's still fairly technical in that, but it was nice that you didn't have as much math in this exam as the CRT. One final note, I had significantly more pulmonary function test questions on this exam. I had very few on the CRT. On this test, I had quite a few PFTs and quite a few of the ventilator graphics, but certainly this test was much heavier in the area of pulmonary function testing. So be up on that. So that's my general take on the RRT. Really, the underlying conclusion that I would draw from this is it's not significantly different from the CRT, and if you do well in the CRT, I would probably expect you to do quite well on the RRT as well. Too many wells in there, but anyway, that's my take on it. If you guys have any specific questions, feel free to ask. Obviously, I'll have to be very careful how I answer because I can't talk about specific questions I encountered. Okay, guys, thanks for hanging in there, and take care.